Hello, welcome to your Latina Medical Center experience. This video will help guide you in your preparation before the day of your surgery. What to expect? First of all, nervous. Don't worry, it's completely normal. Once you have your surgery date, the coordinator will give you the following appointments. Meet your specialist surgeon, who will see you and discuss the details of your surgery sometime before your surgery. Your second appointment will be to do your preoperative tests, and if the results are okay, you will not be contacted and the process will continue. There are some tests that are required in some cases that we do not provide, such as mammograms, ultrasounds, or any tests that the doctor requires extra, and those will need to be scheduled with your primary care physician. If you have a medical condition such as diabetes, high blood pressure, HIV, we will need a medical release from your primary care physician in order to proceed with your surgery. If you smoke nicotine, even if it is electronic, we require a nicotine test which must be done at least 2 weeks prior to your surgery. If you are currently taking any medications or supplements, antiseptics, or any type of vitamin, it is important that you let your surgeon know. In some cases, you will have to stop taking them before your surgery according to your surgeon's instructions. If your procedure includes liposuction, the third appointment will be your first lymphatic massage and cleansing. Your fourth appointment will be with your surgeon. You will receive a call from our Southern California Surgery Center the day before your procedure to give you instructions and arrival time. It is very important that you be on time for your appointment. Here are some tips to help you prepare for your surgery and have an excellent recovery. It is important that you take arnica 3 times a day for at least a week before your surgery and after your surgery to prevent excess of overtosis and swelling. And if your procedure includes fat transfer to your buttocks, it is very important that you get the special pillow that you have to wear the day of your surgery. These products can be purchased at our office. Buy pajamas 1 or 2 sizes larger than your current size, 2-piece shirt and pants, and have the shirt button up front and preferably a dark color. You may drain and it will stain. Buy pads to cover your bed or resting place so they don't get stained, as well as adult diapers 1 or 2 sizes larger than what you regularly use. It is important that you maintain hydration, and for this, you should buy liquids containing electrolytes such as Gatorade, but not red-flavored or similar, because we need to determine if you have vomiting what you are expelling. Nutrition is an important part of your recovery, and for this, you should prepare yourself with fruit, toast, oatmeal for breakfast, and chicken broth, vegetable soup, roasted chicken, wheat bread, and some protein shakes with fruits. It is important that you eat before taking your medications and avoid high-fat foods so that you do not have indigestion. On the day of your surgery, you will not be able to drive any type of vehicle, so a friend or family member is required to bring you to and pick you up after your surgery. We will need that person's contact number so that we can contact them when it is time to take you home. It is very important that this person is available at all times. Communication is very important before and after your surgery, and you will receive calls from our staff at Latina Medical Center and Southern California Surgery Center the next day to let you know how your recovery is going. You will be given a number where you can be in touch with our staff if you have any questions or concerns during your recovery, where you can send texts, photos, and videos. Remember, there are no dumb questions, and it is very important that you let us know of any questions or concerns you may have and not make decisions outside of our medical instructions. There are some symptoms that are very common after your surgery: nausea and vomiting during the first 48 hours, sore throat, inflammation, bruising, even in some areas where you didn't have the procedure. On the day of your surgery, you will wear compression stockings. It is very important that you do not remove them until your doctor says so, and if you feel discomfort, you can lower them a little for a while for comfort, but do not remove them completely. In some cases, you will have a surgical girdle that you should not remove or change for another type of girdle until your doctor tells you to do so. If you feel discomfort, you can loosen it and adjust it, but do not remove it. You will not be able to have a regular bath until your doctor tells you to. You may have sponge baths for your comfort. It is very important that you follow your medication schedule. All surgeries have different levels of pain, and some patients have different pain tolerances, But if your pain is more than you can tolerate, do not speed up or overdo your medications, as they may cause some side effects that will affect your recovery. Do not apply any type of creams or silicones to your scars until your doctor tells you to. The success of good results is the follow-up after your surgery. You have to contemplate that we have to see you at least once a week until your doctor indicates it, and if for time and distance you cannot do your massages with us, it is important that where you go, they have experience in lymphatic massage and post-operative procedures to avoid infections and fluid accumulation. Before your massage, it is important that you eat and take the medications so that you do not have so much pain during the massage and you are not physically weak. You may not drive any type of vehicle, lift more than 10 pounds of weight, do not exercise, do not drink any type of alcoholic beverages, do not smoke, do not enter any type of pool or beach. Avoid places with excessive humidity until your doctor tells you to do so. It is recommended that before your surgery and your recovery, you get vitamins that will speed up your recovery. And for this, we suggest intravenous serums that we offer in our offices at Latina Medical Center, IV. Our doctors recommend 5 sessions of hyperbaric oxygen chamber to oxygen your body and speed up wound healing. All these indications are general and may vary according to the patient and the indications of your specialist surgeon.